Speech pathology is the assessment, management, and treatment of individuals with communication and/or swallowing difficulties. A speech pathologist is a university-trained healthcare professional who works in a range of settings to assist a variety of people with communication and/or swallowing needs across all stages of the lifespan. Communication is the ability to understand and be understood. It can be broken into two components, speech and language. Speech can be separated into the categories of articulation, fluency, and voice. Articulation refers to the way the sounds of speech are produced. A child who has difficulty producing the speech sounds appropriate for his or her age may be referred to work with a speech pathologist on articulation skills and strategies. Fluency is the flow of speech. A person who has a problem with fluency, such as a person with a stutter, could work with a speech pathologist to improve their fluency when speaking. Voice covers areas such as quality, loudness, and tone of voice. A sporting coach who loses his voice on a regular basis could contact a speech pathologist to work on developing strategies to protect and use his voice more effectively. Language can be separated into two areas, expressive language and receptive language. Expressive and receptive language refer to the way a person uses and understands language in a variety of forms. A person who has had a stroke may work with a speech pathologist in a rehabilitation setting on areas within expressive and receptive language such as word order when speaking and understanding instructions. At this point, it is important to remember that not all language is solely in the spoken form. For example, a person who uses Auslan or signing has the capabilities and the means to be an effective communicator. Speech pathologists also assist people having trouble with swallowing and eating. Examples are an individual who has difficulty with swallowing and eating due to the effects of dementia, or a person who has Parkinson's disease and has problems with swallowing as a result. There are many reasons for communication and swallowing difficulties, such as developmental delay, brain injury, stroke, learning disability, intellectual disability, cerebral palsy, dementia, and hearing loss. Speech pathologists conduct their work within a diverse range of settings, including preschools, schools, hospitals, aged care facilities, early intervention, rehabilitation centres, mental health services, private practice, and specialist services for people with complex communication needs. A speech pathologist can work as part of a team of professionals with a person who has complex needs. In this situation, a speech pathologist must work cooperatively with all members of the team to ensure the best outcomes for the individual. In Australia, the work of speech pathologists is guided by Speech Pathology Australia. This is the national peak body for the speech pathology profession. It guides the practice of speech pathologists by providing a code of ethics, information outlining professional standards required to be a speech pathologist, and recommends frameworks for effective speech pathology practice. The Code of Ethics, to which members of the speech pathology profession are bound, outlines how to best serve the client and the community by being a responsible and ethical speech pathologist. The Code of Ethics states the provision of a quality, efficient, and effective service to individuals, the community, and service providers is a key purpose of speech pathology practice. The Code of Ethics also states that the speech pathology profession recognises the rights of individuals to possess an effective form of communication and swallowing. The Code of Ethics outlines the values of the profession, the principles that guide ethical practice, the standards of ethical practice, and the duties of a speech pathologist in relation to clients and to the community, to employers, to the profession and to themselves, as well as to colleagues. Speech Pathology Australia requires an entry-level speech pathologist to have skills in certain areas. These skills are documented in the Competency-Based Occupational Standards, or CBOS. The CBOS applies to all graduate speech pathologists, individuals seeking professional recognition for qualifications gained overseas, and speech pathologists returning to the profession after an extended break. The CBOS sets out 4 generic competencies for all speech pathologists. These are reasoning, communication, lifelong learning, and professionalism. Along with the general competencies, An entry-level speech pathologist must show competence in adult and pediatric speech pathology practice in the areas of language, speech, swallowing, voice, fluency, and multimodal communication. The CBOS documents the principles for practice along with descriptions of the elements, performance criteria, and examples of how the criteria can be applied. A framework endorsed by Speech Pathology Australia is the International Classification of Function, Disability and Health, also known as the ICF. The ICF was released by the World Health Organization in 2001 to be used as a framework across a range of services to describe the health and functioning of all people at any stage of the lifespan. The ICF assesses the health of a person in a holistic manner. It acknowledges that health is a multidimensional concept and there are many factors that contribute to the health of a person. The ICF examines body structures and functions. This is the physical aspects of the disability or disorder. Activities and limitations. This is thinking about the activities of a person at an individual level, as well as the limitations experienced in carrying out these activities. Participation or involvement in life, which is the way a person functions in wider society. And the environmental and personal factors that can have an effect on the health of a person. Using the ICF in speech pathology contributes to developing a comprehensive profile of the client and enables insight into the impact of the disability or disorder on the life of a client, rather than only in the context of communication and/or swallowing. This means that goals are client-focused, made collaboratively, and based on evidence. The Code of Ethics, the competency-based standards for entry-level speech pathologists, and frameworks such as the International Classification of Function, Disability and Health are put forward by Speech Pathology Australia to ensure that each client and their needs are central to speech pathology practice.